Okay, let's get right into debunking a growing right-wing talking point against Medicare for All and against other single-payer type plans, because what we have now is a situation where the right is very much on the defensive because the viability, the superiority of plans like Medicare for All has been increasingly demonstrated over the last several years. There's no question that there are still details to sort out. There are assumptions to fine-tune. But the right recognizes that Medicare for All is more and more popular. It's more and more in demand. The current system is being identified by more and more people as immoral and dysfunctional and unsustainable. So the right has had to come up with new arguments that they can use as a crutch. And the argument that the right and actually some in the centrist left are making more and more is that, wait a second, Medicare for All will kill jobs. And to them, I say, that's right. Welcome to macroeconomics. You're not actually making an argument when you say that. So let's go through it. And we need to be armed with this because this is increasingly something that they are saying. Expenditures are someone else's income. I'm going to explain this today. Please do send this story out to other independent left-wing hosts that you follow so that we can all get on the same page about the talking point and to understand the economics behind it so that we don't allow them to use this terrible argument against us. Medicare for All would reduce the number of jobs in the health insurance sector and in some other areas of healthcare. This is not something we need to hide from. It's instead something that we need to put in context and simply meet head on. The late Uwe Reinhardt, who was a supporter of single-payer systems, pointed this out in his latest book. It's a book I've recommended to you called Priced Out. Healthcare spending is income for people who work in the field, and that includes profits. It includes lots of salaries. It includes costs of treatment and facilities, but that spending is income on the other side. If you reduce healthcare spending, say by 20%, you could be reducing healthcare employment by roughly the same 20%. I'm using crude math. It's not dollar for dollar, but for our argument today, it's good enough. This is not special to healthcare. This is a reality for any move by a government which reduces costs, which can be called spending. This is called the circular flow of income in economics. You have GDP, gross domestic product, which is roughly equal to a country's income, which is roughly equal to a country's production, which is roughly equal to a country's total spending. This is the heart of macroeconomics. They're not making an argument when they say Medicare for All will kill jobs. They just don't understand what that means. It's not a perfect equation, but fundamentally, when someone says Medicare for All would kill jobs, what they mean is spending as much as we do on healthcare funds a lot of unnecessary jobs that we don't need and make healthcare way more expensive. The next question, if you want to go down this path, is it worth switching to a Medicare for All system given that it would reduce employment, broadly speaking, within the health delivery field? I'll give some examples. When a government says we've got to cut spending on education, it's become too bloated, and they say, let's reduce spending on education by 10%. They're talking about reducing income for people working in education by 10%. Spending on education is income for people working in education. This could be everybody gets a 10% pay cut. It could be we lay off 10% of the people working in education. Again, we're looking at the numbers at a crude macro level. In the real world, you can find ways to trim costs that less directly affect employment, but someone's revenue or income or profit is being cut. That's a reality. The point is, when the right sees spending as not worthwhile, when they don't like what we're spending money on, they say we've got to do some responsible spending cuts and we've got to save some money. When the right wants the spending because it's fueling an industry or a sector that they like, they call an attempt to cut spending a job killer. It's a political football, much like debt and deficit. I'll give you one more example. The coal industry. The coal industry should die. Coal has horrible negative externalities, pollution, causes illness, hurts the planet, it's inefficient, it's antiquated. But if you reduce the coal industry by 90%, you cut roughly 90% of those jobs. And that's okay. Sometimes industries are obsolete. We need to figure out how everybody can keep making a living. People are going to need to find other jobs. But the argument that we should just prop up coal so that people don't lose coal jobs is just as bad as saying we shouldn't do Medicare for all because some people will lose jobs. It's a political football. It's like debt and deficit. We've talked about it before. So then it becomes a question of, given that every economic policy affects jobs at a macroeconomic level, what is worth doing? If we cut education spending by 10%, we're cutting teachers by 10%. This will worsen education. It will continue to make us less competitive globally in industry. It'll generate more crime since more educated people commit less crime. It is not good for the economy over the long term. If we cut healthcare spending with something like Medicare for All, we eliminate medical bankruptcies. We put more money in people's pockets to reinvest into the economy by going to local businesses. We eliminate people keeping a job they hate just because they need to keep that health insurance plan. We eliminate people being sicker because they forego earlier treatment to maybe avoid the costs associated with going to the doctor. And yes, that will be associated with a reduction in employment in the healthcare field, including a lot of bloat like medical coding, insurance fraud investigators, so on and so forth. Isn't that worth it? There have been job realignments in the United States forever. Other large economies have had technological advances and changes that reduce employment within certain industries. Priorities change. This is nothing new. It's not an argument to say, but that will kill jobs. So don't fall for it. Don't fall for the trap of accepting that any government policy, it's like, you know how the right says the left uses "I'm offended" to stop conversation. As soon as they say "I'm offended," they end the conversation. The right says that policy will kill jobs, and they use it like a cudgel, similarly, to just end a conversation. Don't accept that just because a policy reduces employment in a particular industry, it's bad and we shouldn't do it. Economies adjust with our help, with our planning. And on the other side of the equation, you will have healthier people who are more economically productive. You will have people in jobs they like rather than jobs they are keeping just to keep that high deductible, crappy health insurance plan. We cannot allow the right to set the agenda on this issue and to concern troll over jobs when it's convenient, but then to call cost reductions savings when they like them. We need to take back the talking point. So let's all get on the same page on this one. Like I said, if there's other people you watch who are trying to deal with this talking point, send them this clip. Let's get on the same page because they are using this talking point a lot and we need to be prepared to defend against it.